Welcome to Driving Safety for the Older Adult. I am Camille Fitzpatrick, a geriatric nurse practitioner from the University of California, Irvine, Sue and Bill Gross School of Nursing. This project is supported by the Health Resources and Services Administration of the United States Department of Health and Human Services. Today, we will discuss who to assess, how to report, and resources and referrals. Material for this podcast is adapted from the Clinician's Guide to Assessing and Counseling Older Drivers, 3rd edition, published by the American Geriatric Society, in collaboration with the U.S. Department of Transportation Highway Traffic Safety Administration. Who should be screened for driver safety? All at a baseline at age 65. All those with a recent major health change. Those with cognitive changes, vision changes, frailty, loss of consciousness, seizures, and polypharmacy. And also when a family member expresses concern over their loved one's driving ability. How do we screen for driver safety? The Clinical Assessment of Driving-Related Skills, CADRAS, is a toolbox of evidence-based, practical office-based functional assessment tools in the key areas of vision, cognition, and motor and sensory function related to driving. So let's do a case. Our patient is an 81-year-old female presenting to the clinic one day after a syncopal episode during a 2-mile walk. Question 1. In the course of evaluating patients, what is your legal obligation? Question 2. What conditions does lapse of consciousness cover? Question 3. What information does DMV need? And question 4, what resources are available to the patient? So what is your legal obligation? California is one of 5 states with mandatory reporting. If you are watching this podcast and are not from California, please check your state law for reporting laws. Title 17 on the California Code of Regulations, Section 2810, requires clinicians to report conditions that cause lapses of consciousness, seizures, or diseases related to Alzheimer's and other dementias. Disorders characterized by lapses of consciousness refer to conditions that involve marked reduction of alertness or responsiveness to external stimuli and inability to perform one or more activities of daily living. What causes losses of consciousness? Cardiac, neurologic, including seizures, metabolic, including hypoglycemia, and other disorders. Our patient with a syncopal episode qualifies as having loss of consciousness. Prior to reporting to the DMV, our patient had labs drawn for dehydration and other metabolic causes and had a resting EKG. She was advised not to drive, and a report was then made to the DMV. While waiting for the DMV medical evaluation, the patient had a 3-day Holter monitoring and an echo. How do we report? Any of the following 3 options are acceptable. First, report to the local public health department on the Reportable Diseases Reporting Form, the Confidentiality and Morbidity Report. They will then forward the form to the DMV. The second way to report is reporting directly to the DMV using the driver reexamination form. This form can also be completed by a non-medical person, such as by a police officer or concerned family member or neighbor. And finally, the third way to report an unsafe driver is to document on your letterhead and fax to the local DMV driver safety office. Please be sure to tell your patient you are reporting her and document in the chart that you have advised against driving until DMV has completed their evaluation. After your notification of DMV, the patient will receive a medical evaluation form, which they must bring to their health care provider for completion. This is a 5-page form to be completed as best you can. 2 questions on the form of particular importance to the DMV. Do you currently advise against driving, and would you recommend a driving test be given by the DMV? The patient will take the completed form to the DMV, where they will be evaluated in a formal hearing, which includes review of your recommendations, their past driving history, a written and eye examination, and also they may have an on-the-road driving assessment. Based on DMV's evaluation, the patient may have further evaluation. They may have a limited license, including short distances or no night driving, and a repeat testing at DMV in 6 to 12 months. DMV also may immediately revoke the license at that time. The California DMV has a wonderful website for older adults that includes how to remain a safe driver. I also recommend the following resources for patients and their families. And finally, if you would like more information in the area of driving safety, I would refer you to the Clinician's Guide to Assessing and Counseling Older Drivers 3rd edition and to the TREADS, UCSD Training, Research, and Education for Driving Safety with Dr. Linda Hill. Thank you and happy traveling.